Hello and welcome to today's edition of GP Notebook podcasts. My name is Dr. Hannah Rosa. I'm a GP working in the northeast of England and a member of the GP Notebook education team. Join us for a whole range of bite-sized topics tailored for those working in primary care. Perfect for your daily commute or when you're out walking the dog. You can tune in to us on all leading podcast platforms and don't forget to like and subscribe so you don't miss an episode. And if you enjoy what you hear, please consider leaving a review. You can stay connected with us on X at GP Notebook for podcast updates and by visiting our new GP Notebook website. Now, let's get started. In this episode, the team and I have been reflecting upon all that we have learnt over the last 12 months, and we have pulled some of that learning together to create an end-of-year GP Notebook podcast quiz. For those of you who have joined us virtually on one or more of our study groups, then first of all, thank you. And secondly, you may recognise some of the topics that this quiz covers, and this may give you an advantage when it comes to obtaining the highest scores. For anyone listening who hasn't been at a GP Notebook study group, then don't worry, you are extremely welcome. And if you are interested, then the details for our new set of study groups for next year can now be found on our website. Now to the quiz. If you can, grab a pen and a piece of paper and feel free to pause the podcast if extra thinking time is needed. We have 4 rounds, followed by a bonus question, and all the answers will be revealed at the end. Good luck and straight in to round 1, which looks at results. Question 1. For primary prevention of cardiovascular disease with statins, we aim for a greater than 40% reduction in non-HDL cholesterol. But what are the targets for secondary prevention? Question 2. When treating adults with familial hypercholesterolemia with statins, we should be aiming to reduce their LDL cholesterol by how much? Question 3. Which statin is associated with the lowest risk of developing new-onset diabetes? Simvastatin, pravastatin, or atorvastatin? Question 4. Patients with non-alcoholic fatty liver disease who have a low risk score of fibrosis on a scoring system, for example FIB4, should be reassessed every how many years? Question 5. What is the sensitivity of a chest X-ray for symptomatic lung cancer? Is it A, 60%, B, 75%, or C, 90%? And our last question for round 1, question 6. When managing a patient with atrial fibrillation, why is it important to ask them about their sleep? Round 2. Please answer true or false to the following questions. Question 7. We should advise people who are using emollient creams to avoid smoking. Question 8. Sunlight can worsen acne. Question 9. Single nicotine replacement therapy is more effective than a combination of nicotine replacement therapies. Question 10. The same BMI thresholds apply to all adults. Question 11. Psychological therapies, such as cognitive behaviour therapy, may reduce dyspepsia in the short term in individual people. Question 12. Patients with peripheral arterial disease who are asymptomatic have less severe disease than those with claudication. Now, time for round 3, a quick fire round. Question 13. For adults with OCD, the initial pharmacological treatment should be with an SSRI. Which one can be prescribed as a treatment for OCD but isn't licensed for this use? Fluoxetine, sertraline, paroxetine or citalopram? Question 14. What is the name of the classical rash often seen as a presenting feature in Lyme disease? Question 15. What reaction occurs in up to 15% of people after being treated with antibiotics for Lyme disease? Question 16. What type of analgesia should be used to treat trigeminal neuralgia? Paracetamol, codeine, NSAIDs, or none of these? Question 17. The highest rates of esophageal cancer for men in the UK occur in the 85 to 89 age group. For women, are the highest rates found at a younger age, at the same age, or at an older age? Question 18. Which bite is associated with the highest risk of abscesses and osteomyelitis? Dog, cat, or human? Round 4, which focuses on women's and men's health. Question 19. When reviewing women at their 6-week postnatal checks, if they've had gestational diabetes during pregnancy with a normal blood glucose level prior to discharge after delivery, then when should their glucose levels next be checked? Question 20. If a woman is diagnosed with iron deficiency anemia in pregnancy, how long does she need to continue her iron tablets for? Question 21. Would you prescribe HRT for a woman who is having regular periods and has a history of migraines with aura? And if so, which type? Question 22. True or false? Testosterone treatment is associated with an increased risk of prostate cancer. Question 23. A major new prostate cancer screening trial has begun in the UK, and in early 2025 the first men will be invited to take part. What is the name of this trial? Question 24. What is the false positive rate of the PSA test for prostate cancer? Is it 55%, 75%, or 95%? And our bonus question, question 25. By which other name is haemophilia B known? Now, time for the answers. Question 1. Following NICE guidelines, for secondary prevention of cardiovascular disease, we should aim for an LDL cholesterol level of 2 or less, or non-HDL cholesterol level of 2.6 or less. Question 2. For adults with familial hypercholesterolemia, we should aim for at least a 50% reduction in LDL from the baseline measurement. Question 3. Pravastatin is associated with the lowest risk of developing new-onset diabetes. Question 4. People with non-alcoholic fatty liver disease who have a low risk of significant fibrosis should be reassessed every 3 years. Question 5. The sensitivity of a chest X-ray for symptomatic lung cancer is 75%. Meaning that around a quarter of patients with symptoms of lung cancer will have a normal chest X-ray. Question 6. We should ask patients with atrial fibrillation if they have any symptoms suggestive of obstructive sleep apnea, as it is a risk factor for the development of AF and treating it can reduce cardiovascular mortality. Question 7 is true. We should advise people who are using emollient creams to avoid smoking, as fabric burns quicker and hotter when contaminated with emollients, and this increases the risks of severe and fatal burns. Question 8 is also true. UV light can worsen acne and induce post-inflammatory hyperpigmentation and erythema. Question 9 is false. We should always advise the use of a combination of nicotine replacement therapies, as this increases the likelihood of a successful quit attempt. Question 10 is also false. The BMI thresholds are lower for people with a South Asian, Chinese, other Asian, Middle Eastern, Black African, or African Caribbean family background. Question 11 is true. Psychological therapies, such as cognitive behavioural therapy, may reduce dyspepsia in the short term for some people. Question 12 is false. The outcomes for asymptomatic peripheral vascular disease are similar to those with claudication. Question 13, citalopram can be prescribed as a treatment for OCD, but isn't licensed for this use. Question 14, the classical rash often seen as a presenting feature in Lyme disease is erythema migrans. Question 15, the reaction which occurs in up to 15% of people after being treated with antibiotics for Lyme disease is a Jarisch-Herxheimer reaction. It occurs within 24 hours of antibiotic therapy for spirochetal infections, including syphilis and Lyme disease. Question 16, the answer is none of these, as they are all ineffective for trigeminal neuralgia. We should use carbamazepine. Question 17, the highest rates of esophageal cancer occur at an older age for females, with the highest rates being in the 90+ age group. Question 18, the answer is cat bites, as cats have very fine and very sharp teeth, which cause deep inoculation of bacteria. Question 19. Women who have had gestational diabetes should be offered a fasting plasma glucose test 6 to 13 weeks after the birth. Or if this hasn't been done, then after 13 weeks they should be offered either a fasting plasma glucose or a HbA1c. Question 20. Guidelines advise that pregnant women should continue their iron tablets for 3 months after their HB has returned into the normal range and until at least 6 weeks postpartum. Question 21. Migraine with aura does not contraindicate HRT, and fluctuating estrogen levels can increase migraine prevalence during the perimenopause. Using an estrogen in a patch or gel with a progestogen that provides continuous delivery is most suitable. And as she is perimenopausal, then a levonorgestrel intrauterine system would be best. Question 22 is false. Testosterone treatment is not associated with an increased risk of prostate cancer. Question 23. The new prostate cancer screening trial is called the Transform trial. Question 24. 75% of people with a raised PSA will have a negative prostate biopsy. And finally, our bonus question, number 25. Haemophilia B is also known as Christmas disease. How did you do? Thank you for listening. I hope that you found this podcast enjoyable and that you've learned a few extra nuggets of information. As always, all the links to the resources used to create this podcast are in the show notes at GPnotebook.com, and we'd be very grateful if you would consider following the podcast and leaving us a review on your favourite podcast platform. Please visit us at GPnotebook.com to find out more about our new set of GP Notebook study groups and to explore a wealth of clinical information. We will be taking a 1-week break from the podcast over the Christmas holiday, but we will be back with another episode in the first week of January. In the meantime, I hope that you have an enjoyable festive season and don't go annoying too many cats. Goodbye.